Welcome, everybody. Thank you so much for taking some time this afternoon to talk with us and to hear from us about this new big change in New York State. Today, we're going to be talking about modernizing Medicaid applications and renewals for older adults and people with disabilities in New York State. My name is Rachel Holtzman. I am a policy consultant working with NILAG, and joined with me today is Rebecca Wallach, the director of the Evelyn Frank Legal Resources Program, also called FLRP at NILAG. So first, just a few webinar logistics. All of you should be on mute just as the default. That'll just make sure that Rebecca and I have the time we need to get through the presentation. But if you have any questions, feel free to post it in the Q&A, which is one of the features at the bottom of your screen. We are also going to send out a copy of the slides and a recording of the presentation to everybody who registered. So if something comes up and you need to hop off early, don't worry, we're going to send you a recording. And feel free to share the recording and the slides with others. We want to make sure to get the word out. So just briefly, a note about NILAG, the New York Legal Assistance Group. So NILAG is a nonprofit legal services law firm in New York City. NILAG uses the power of the law to help New Yorkers experiencing poverty or in crisis to combat economic, racial, and social injustice. I'm not going to read the rest of our statement here, but you can read more about us on our website. And a little about our unit. So within NILAG, Rebecca is the director of the Evelyn Frank Legal Resources Program, also called FLRP. FLRP focuses on fighting for older adults and people with disabilities to ensure they have access to health care and home care services so they can age safely in their home and communities. FLRP does counseling, trainings like these, individual representation, and really focuses on Medicaid home care and MLTC plans. And we want to make sure everybody knows about the website that FLRP is heavily involved in updating. It's called New York Health Access, and you can see the links up on your screen, and I'm going to put them into the chat as well. So New York Health Access, which is now in the chat, has policy updates, consumer materials, and a lot of just public-facing resources about coverage, criteria, and eligibility. We have an article that's specifically focused on MECM, and I'm going to put that into the chat as well. And we have a lot of different great articles about all sorts of things related to Medicaid, Medicare, and health insurance in New York State. So we recommend you save that website. So before we really dive in, just want to make sure everyone also knows about our newsletter. FLRP puts out a newsletter. We will not flood your inbox. It's once a month, maybe once every other month. And it's gives you the information about our upcoming trainings, our outreach materials, our educational materials. It's a great newsletter to stay up to date and to join our network. So we recommend that you join, totally free to join. I'm going to put that link in the chat as well. And please feel free to share it. We have a lot of social workers, caregivers, legal services advocates, self-advocates, and family members who are on this listserv, as well as others. So to go over briefly the agenda for today, we're going to give a background on Medicaid, the different types of Medicaid, just to make sure everyone's on the same page. Then we're going to give an intro to this new system called MECM, and that stands for Medicaid Eligibility and Client Management System. We're going to talk about what eligibility systems looked like for Medicaid in New York State before and after this new system. Talk about how you can find where your client's case lives, which of these systems is it in, talk about renewals, talk about navigating the MECM portal, tips for NISO appeals, where to go for help, and finally, if we have some time at the end, we'd love to have some Q&A. So with that, I'm going to turn it over to my colleague, Rebecca, who will just do some level setting on Medicaid background.
Thanks, Rachel. It's really lovely to be here. I'm happy to see so many people come out in the middle of December to learn more about this program. We're going to start with some Medicaid background to make sure that the alphabet soup that we're inevitably going to fall into hopefully makes some sense to everybody participating. So Medicaid is comprehensive health insurance for New Yorkers, and it does require financial eligibility. It's a means-tested program. And broadly speaking, there are two big types of eligibility categories for Medicaid, financial eligibility categories for Medicaid. We refer to them as MAGI Medicaid and non-MAGI Medicaid in this presentation. And let's just talk a little bit about what the differences are between them. So so let's start with MAGI Medicaid. Because it's Medicaid, we often have many words to mean the same thing. So MAGI Medicaid enrollees are generally people under 65 who do not have Medicare. They might be referred to as expansion enrollees or Obamacare or ACA enrollees. Non-MAGI Medicaid, on the other side, is for those New Yorkers who are over the age of 65 or who are under 65 and have a disability. They're blind or disabled, and they may have Medicare as a result of that. This group may also be referred to as SSI related. ABD for age blind disabled, or DAB, just moving the letters around, for disabled aged blind. So if you're hearing any of those terms, that's referring to non-MAGI Medicaid. And before we go to the next slide, the reason it's so important to know the difference between the two of these for our conversation about MECM is because for the vast majority of people who are going to be affected by this system, they're in the non-MAGI category. And we're going to go into more depth on that. But drilling deeper into these two eligibility categories, you see that under each one, under the MAGI eligibility group and the non-MAGI eligibility group, it's further stratified into different eligibility categories. So let's look at focusing on the MAGI group. Individuals that might fit under this group would be pregnant people, infants and children under 19, what's referred to as the new adult group in this document, because this came out this came out a while ago, and parent caretaker relatives, 19, 20-year-olds, children in foster care. Now, on the other side, the non-MAGI side, we have people who receive SSI, the DAB, and a whole slew of other programs that use this kind of budgeting. So this kind of gives you the idea of the complexity of what these broader terms mean, MAGI and non-MAGI, and how they're identified within our Medicaid system in New York. And so what's the difference between these two groups? Now, this is not a presentation on financial eligibility for these groups, and we could do long trainings on them. But on the MAGI side, the income limit is generally 138% of federal poverty level. It can change depending on who you are categorically, but the rules are using tax rules for your income. And there's no asset limit. That means that you could have any kind of resources, and if your income meets the eligibility, the limits, then you will be eligible for MAGI Medicaid. On the other side, on non-MAGI, we're also at 138% of the federal poverty level, the lowest, which was a huge win for our state in 2023. But the way income is calculated is different. Each type of income has a special rule, and that contributes to whether the person is income eligible, and there is an asset limit. So whoever's reviewing your eligibility has to look at money that you have in the bank or stocks or other types of assets that you might have, and make sure that you are eligible on the asset side. So that's level setting. And now when we refer to MAGI and non-MAGI in this presentation, you'll have a sense of what we're talking about. So let's jump into the who, what, where, when, why of MECM right now. So who is this going to affect? Already, I'm going to be referring to the non-MAGI cases again. So as of just a few days ago, on December 1st, MECM is for applications for non-MAGI Medicaid for individuals who are not going to be using a nursing home, who don't need long-term care, who don't have eligibility over the income limits, and aren't using pooled income trusts. MECM also applies to applicants for people who are eligible for the Medicare Savings Program. This is a benefit that is for dual eligibles, people who have Medicare. It pays for their Medicare Part B premium, which is over $200 a month now, and reduces their prescription costs. It's an amazing program and really can contribute to a person's personal economy because it's worth so much more. So MECM is going to apply to just those two groups of applicants. You might apply for one benefit or both. It also applies as of 12/1 to certain case transfers. So there were about 13,000 cases of people who are eligible for non-Magi Medicaid, and their cases were in the New York State of Health, and they were transferred into this new MECM system on December 1st. And we are going to talk a lot more about that as the presentation goes on. And then let's move on to the next slide. MECM is going to affect a lot more people in the future. The big aim here is to bring Medicaid eligibility determinations away from the local districts and HRA in New York City and on to MECM into the New York State of Health. We'll define those terms as we go. And it's going to happen in waves. The first wave we just reviewed. And, you know, we've heard different timeframes from the state, whether it would be 3, 5, 10 years out, that eventually every eligibility group on that non-Magi side would come into this new system. And then we know over the next year, it's not just going to be those 13,000 cases that were transferred. It's going to be about 150,000 non-Magi cases that are going to transfer from the New York State of Health over to MECM. And if you're confused about that, don't worry, we're going to get into it as we go. So that's the who. So let's see, what is the what? What is MECM? Hopefully it's starting to make a little bit of sense, but MECM is a back-end eligibility system. It's an online application and renewal system for non-Magi Medicaid at this point that processes eligibility, either approving the individual for services or denying the individual for services or continuing their coverage or stopping their coverage. It is helpful to think about it as a door that you go through to access Medicaid. And as I said, this migration is going to happen over a period of time. MECM is being developed with the New York State Department of Health and their contractor, Deloitte. And it's going to be housed in the New York State of Health sort of branding home. So we'll get into that as well too. A really important point here is that MECM is handling applications and renewals. It's not handling services. So if you have a dispute about home care or a prior authorization for a particular issue or a particular piece of durable medical equipment or for a surgery or a lab test, none of that is going to be processed or reviewed through MECM. This is about whether the individual meets the eligibility criteria at application for Medicaid and whether they're going to meet it on an ongoing basis. So we did the who, the what, and now the next slide is when. This has started. It's pretty exciting. The state soft launched MECM for those two populations in that transfer group, beginning at the end of September of this year. And the system has gone live as of December 1. So individuals can apply for MSP and non-Magi Medicaid using MECM now. We expect the next big change or expansion to happen in February. And that will be additional groups transferring into the system and possibly groups transferring from the local districts who meet those criteria that we have reviewed into the system. And a very important practice point here is people can continue to apply for MSP, non-Magi Medicaid at the districts right now. Nothing has stopped on the current process for application. So it's an additional way to access the services right now. Eventually, we expect that to change, but that's probably down the road a fair amount. Next slide. And here, where does MECM live? MECM lives on the New York State of Health which is our statewide marketplace where people are enrolling in qualified health plans, the essential plan, or Magi Medicaid. And so that has been the case for about a decade at this point. And what we're doing here with MECM is bringing these new populations online. We also, and this right here is a screenshot of the front page of the New York State of Health's website right now. And you see there, big news, enrollment available for individuals who are age 65 or older, have a disability or health need. And that's where we're going to click, and we are going to go through some screenshots of that later in the presentation. MECM, we know as advocates what MECM is, but for many applicants, they are not going to know that they're in the MECM eligibility system. Everything is branded as the New York State of Health, or as we often refer to it as NYSA. Next slide. And I think we get this question a lot. Why is the state focusing on this? Why would they be making these big changes when there's so many things changing with the program right now? And I think the reasons, there's a lot of reasons. And it is an investment in a new updated eligibility system that can have quicker results, for example. So we're going to go through this more too. But right now, so far, with this first group of people who have been applying, about 93% of the applications received a real-time eligibility determination once they submitted all the information online. So that 45-day wait can be significantly reduced. The online MSP application, I think, might be a game changer. We know that there's maybe 300,000 New Yorkers who are eligible for this program who aren't even aware, and now they're going to be able to apply online. And the first bullet here, the self-attestation nudge engine seamless data match. That's something that newer eligibility systems can do. They can, users and applicants can attest to certain criteria, financial criteria, and then the systems on the back end can match it without requiring as much paperwork. And that's not something that our legacy system can do, which we will define in a second. It's called WMS, and it was developed many decades ago, and it's becoming outdated and unable to do many of these things I've just reviewed. The last thing I'll say before I wrap up this section is the other big benefit of MECM is going to be something called administrative renewals. And these are oftentimes referred to as ex parte renewals as well. And what this means is that the system itself can review your eligibility on the annual basis, that we're required to review Medicaid eligibility, and hopefully make a determination without requiring the beneficiary to even submit a paper renewal. Without them doing anything, their coverage continues, reducing a lot of churn and a lot of headache that I know we've all seen in our casework. So with that, I think that's my last slide, right, Rachel?
That's right. Yep, that's right. Thanks, Rebecca. Okay, great. So Rebecca was just talking here about the systems, right? The data matching of these eligibility systems, and it can sound really wonky, but so we're going to just break it down a little bit more. So this is a typewriter, as you guys can see. We're going to talk a little bit about eligibility systems before, sort of thinking about the old times, that's the typewriter, and after MECM. So before MECM, there have been two eligibility systems. And Rebecca said this, but just to emphasize again, an eligibility system is just the computer system that figures out if you're eligible. Yes or no. And there's different types of eligibility systems for different types of Medicaid. So historically, there have been two. So on the left, we have WMS, which Rebecca was talking about, the welfare management system. There's an old computer shown here because the system was developed in the 70s. This is an old system. Sometimes you'll hear people call it a legacy system. This is the system that it's called the local departments of social services, or in New York City, we call it HRA. So this is at the county level, those departments of social services. They've been using this old system from the 70s. Okay, that's 50 plus years old, right? So it's an old clunky system. On the right, the other eligibility system that we've had in New York is NISO. And I know it's a little confusing because NISO is also what we call the website. You can see in the chat, the most recent chat I posted is the actual link for NISO, but also the eligibility system itself is called NISO. And this is much newer and it was developed out of the Affordable Care Act in the 2010s. Okay, so 40 years of difference between those two. And we're going to just talk briefly about how those two eligibility systems have handled applications. And then we'll talk about how those two eligibility systems have handled renewals. Because just as a reminder, we are not talking about services. We're not talking about whether you can get home care, a wheelchair, your medications. We are just talking about if you can get and stay eligible for Medicaid and MSP. Okay, so for historically, before MECM, non-Magi Medicaid applications needed to be filled out by hand or on your computer and then submitted to the local departments of social services or HRA. So you guys are probably really familiar with these forms up on the screen, the DOH 4220 and the Supplement A. So once these were filled out and sent or delivered to the LDSS, then this old system at the LDSS would go beep, bop, boop, calculate everything, take a while, and from what was on your paper, they would tell you if you were or you were not eligible for non-Magi Medicaid based upon your application. And how did it work for Magi Medicaid? So Magi Medicaid has used this website, NISO. And so you would fill it out online, fill out your application online, and click submit, and boop, it would immediately run your information online and determine if you were eligible. So you didn't have to fill out a paper application. And generally, Magi Medicaid has been a lot quicker to make decisions because it's this newer online eligibility system. And how about renewals? How do these two systems handle renewals? So for non-Magi Medicaid renewals, again, a lot of the folks on this call who are in New York City, you've probably seen many of these renewal papers, packets that come in that gray envelope with the barcode. We have a great training about best practices for Medicaid renewals in New York City that you can find on the NILAG YouTube page. There's a recording of that training. But you had to fill it out by hand, try to fit it into the gray envelope, and send it to the LDSS. And then again, it would be processed by this old computer system called WMS that would try to figure out if you were still eligible for Medicaid, for non-Magi Medicaid. And meanwhile, Magi Medicaid renewals were also online, just like applications. So you would just type your information online, and the NISO eligibility system would be able to just online check if you were eligible, if you were still eligible, and then tell you yes or no. Okay, so I was saying those were the two systems that used to exist. And now there's a third eligibility system in New York, and it's called MECM. That's this entire thing that we're talking about. So how does MECM work? Okay, so just as a reminder, these are the two that we were just talking about. On the left, you have the newer NISO system that has existed for Magi Medicaid on the NISO website. And on the right, you had the old WMS system. And now there's going to be a third system. And we made this a smartphone because this is the newest system of the three, and it's called MECM. And it's for non-Magi Medicaid and MSP, and it's going to live inside of NISO, which is again why Rebecca said some clients may not even know that they are in this MECM system because the notices they get and the emails they get, if they get emails and the website they go to, it's going to say NISO. So how's it going so far? We're going to just briefly share some information from the State Department of Health about how applications have gone so far. From September 30th to December 5th, there have been 2,700 applications submitted by the NISO call center, 183 submitted by MECM assisters. We're going to talk later about who those people are, and 465 just submitted by the public. A bit over 300 were for MSP only, about 576 were Medicaid only, and the majority were for MSP and Medicaid. You can see that at the middle bottom of the screen. 2,438 were for both. Um, some of these cases were referred to WMS, that system at the local Department of Social Services. 667 were sent downstate and 591 were sent upstate. And then there were some referrals to NISO. So if somebody applied, but actually they should have had MAGI Medicaid, then MECM sent them over to NISO. We know many of you have questions about these referral processes. I know someone already posted one of those questions in the Q&A. We don't have more details about these referral processes, but once we have more information from the state, we would be happy to share it. Okay, so now I'm going to talk, actually, I'm going to pass this over to Rebecca to talk about how you can figure out where your client's case lives.
So as Rachel was just saying, we have these three systems, these three doors, and that we need to know and we need to be able to identify on behalf of our clients, because that is going to help us to figure out where we're going to be advocating to fix a problem, right? Is it going to be at the local district? Is it going to be through NISO, or is it going to be through MECM NISO? So we sort of pulled this together right here as sort of a guessing game, and also to point out special tips for when you're reviewing notices to help direct you to the right door for advocacy. And this is going to come up with advocacy that we do on an individual basis, or even just being that traffic light or that traffic cop, I guess, that directs your client to the right agency or system. And then it comes up again when we're talking about appeals. Okay, so let's go to the first one. This is a notice. This is probably familiar to many people on in this training, a notice of decision on your medical assistance. And we see the notice date at the top, and that some agency is going to be taking action to discontinue this person's Medicaid effective October 2nd, 2019. And the reason is because you or your representative did not return the recertification form by the deadline. So where does this case live? Well, we have a few it lives in the district, the DSS or HRA. And if you go back to the notice, Rachel, yeah, you'll see it says Medical Assistance Program at the top, MLTC CASA. And for those of us in New York City, we're very familiar with that address. But generally, this type of notice, this CNS notice, generally it's going to be affiliated with the local district or HRA if you're in New York City. So it's that door, the far door on the red door. Okay, here's another one on our next page. This is what we would call a manual notice. It's giving somebody a budget and a surplus determination. And you see it says NYC Human Resources Administration in the top. It's branded for HRA. And survey says it's going to the same red door on the next slide. This is going to be a case that is still with HRA, and the advocacy is going to go to HRA to try to resolve any kind of issue. We promise in our next presentation to add some from other DSSs outside of New York City. Here is some notices that are branded from the New York State of Health. And they are telling us important information about plan enrollment and our eligibility. Let's see. So there's some really important keys here. And if you want to press the next, yes, right here. So I know, and now you are going to know, that these cases are in the NISO system, that these are MAGI cases. And I know it for two reasons, because the account number begins with the letters AC, and the marketplace ID number begins with the letters HX. So you're always going to be looking on the account number and the marketplace ID to help locate where your client's case is in one of these systems. And so in this case, then, if we go to the next slide, it's the blue door. This beneficiary is in the NISO system, and they have MAGI Medicaid. And we know that because of the AC and the HX. All right, so the next slide here. These are also branded New York State of Health, but you will see a difference here. Well, if you read this, it says, starting September 1, you qualify for the Medicare Savings Program, qualified Medicare benefit at the qualified Medicare beneficiary level. So that's a clue right there that this is probably MECM because it's talking about MSP. But I have another clue, which is looking at these case numbers and member IDs. So for any individual whose case is being evaluated in MECM, their case number is going to start with MC and their member ID is going to start with PX. So these are really important tips for you to be able to direct your client to the right entity to fix the case and for you to know where to appeal, which we are going to spend some time talking about in this presentation later on. Yeah. Oh, and that's the green door in the middle, the new one with the cell phone.
Great. Thanks, Rebecca. And what we're really hoping for, again, we're going to send out these slides. And if you have a client who gets a notice and you're really not sure, pull back up these slides and just look at the notice and compare it to these slides and try to figure out which system is your client's case in. Because again, you need to first know which of these doors your client's case is in before you can really know how to effectively advocate on their behalf. Okay, so now I'm going to just talk about this first batch of cases that were transferred from NISO to MECM. And just to review, I know Rebecca spoke about this earlier. So MECM is a system where some people who don't have Medicaid right now, they can go into MECM and apply for the first time for Medicaid if they meet that wave one criteria, the simple non-MAGI cases, no long-term care, no spend down, et cetera. But also, there are some people who already had Medicaid and they had non-MAGI Medicaid within NISO, and they were only really kept in NISO because of something called an E14 waiver from the COVID era. Essentially, they started with MAGI Medicaid on NISO, they became a dual eligible, they became non-MAGI, but they just stayed put. Those people's cases shouldn't really be in NISO, right? Because it's non-MAGI, and NISO is supposed to be just for MAGI. So those cases are being transferred from NISO into MECM. And as Rebecca said, 13,000 of those cases were transferred on September 30th, and their renewal just happened December 5th. So that's what we're going to talk about here. So this is renewals for the first batch of cases that were transferred from NISO to MECM. So again, just as a reminder, 13,000 non-MAGI Medicaid enrollees were transferred. These cases, when they were in NISO, they had a December 1st renewal date. They were transferred on September 30th into the new MECM system. And then on December 5th, just a few days after they would have had their renewal date, on December 5th is when MECM ran their renewal. So the MECM, so this is in the second box here that I'm sort of talking about what happened on December 5th. And we want to make sure that you understand what's happening for renewals because we think that the first notices that clients are going to get are going to be related to these renewals. So the MECM system first reached out behind the scenes to existing state data sources and federal data sources to try to get the renewal information that was needed. This could only be done if the client had filled out that form. It's called an AVS form. It gives the system permission to talk with the other data systems. But if the client had filled out that AVS, then MECM tried to first, behind the scenes, look at these other systems and see if MECM could get all the information it needed. And 33% of these 13,000 people, their cases were renewed without them lifting a finger. Okay, so all the information that was needed was fully available on existing online state and federal data sources. So MECM could, sometimes it's called ex parte renewed, sometimes it's called administratively renewed, or you could think about it sort of as like automatically renewed their applications, and the person didn't have to lift a finger. How awesome is that, right? I mean, again, so many of you have probably helped people fill out those HRA renewal forms that are very lengthy and can be cumbersome. And for 33% of these 13,000 people, it just happened like that behind the scenes and the person never had to do anything. For 67%, that was a little over 9,000 people, the system could not do it by itself. And so they were sent a letter telling them that they needed to manually renew. The letter is branded as NISO. So across the top, it says NISO, and it tells the consumer that they have to renew their Medicaid in the system by no later than January 15th of next year, 2026. So, what's going to happen that next day on January 16th? For any of those people who have not completed their renewal, MECM is going to send them a notice, a letter that's going to be, again, branded as NISO, informing them that their coverage is going to end. It's going to terminate on January 31st. These people have the right to appeal and to ask for aid continuing. And we're going to talk more about the appeals process, but we really want everyone in this webinar to spread the word about that because we expect that some clients are already coming to you and more will come to you in the upcoming weeks telling you that they got a notice from NISO saying that their Medicaid is ending or that they need to renew their Medicaid by January 15th. And then in the latter half of January, you guys are going to get clients coming to you saying, "What? I have a letter from NISO telling me that my Medicaid is ending January 31st. What do I do?" And these people have the right to appeal. So if you think that they are still eligible for Medicaid, they should appeal and ask for aid continuing. So just a quick point on notices here. The default is that renewals are sent out in the mail and that notices are sent out in the mail unless the person within the MECM system sets their communication preferences to electronic, in which case the person is going to get notices via email. MECM is also supposed to send text message reminders for renewals, just like how NISO does it. This is new, but this is how we've been told from the state that it's supposed to work. So on the screen is a photo of a NISO notice that is about a renewal. We do not have an example yet of an MECM notice about a renewal, but this top left-hand part that says NISO, that's going to be on the MECM notices too, because MECM is branded as NISO. So the client's going to get a letter that looks like it's from NISO that says something about, please log on, please complete your renewal. As Rebecca said, although these NISO notices have account IDs that start with AC and marketplace IDs that start with HX, for the MECM notices, it's going to have an account ID that starts with MC and a marketplace or a case ID here that's going to say PX. And there's different ways that you can renew, that the client can renew. They can log in. It's supposed to be the same login information that they had on NISO. Will be the login information for MECM. So they can log into their account, or you could help them log into their account and they can renew online. Or they can call the NISO call center, or they can get help from an MECM assister. So there's 3 ways that they can renew. And we'll talk through MECM assisters on a future slide. Okay, so that was a lot of background, and now we want to really dive into the MECM portal. Okay, so what does it actually look like inside MECM? And we're really going to start from the beginning. If you wanted to create an account to apply for, or if your client wanted to create an account to apply for Medicaid and they meet that wave 1 criteria, how do they create an account and apply through MECM? Now, just a quick point, all of the slides that I'm showing you are for somebody who is applying for the first time on MECM. For people who already had a case on NISO, they should be able to just use their existing login information. So the upcoming slides should not apply to them. Okay, so if you have a wave 1 client, again, non-Magi, without long-term care needs, without a spend down, no pooled income trust, and they want to apply for non-Magi Medicaid on MECM, they can do that right now. And here's the steps. So first, you have to create an account on ny.gov, or an ID rather. And, some clients will already have this because sometimes it's used for the DMV or for other New York State services. But there's 3 steps to it. On the left, we have this step 1 for creating an account. It's going to ask for first and last name, email, mobile phone number, and creating a username. Step 2, the slide in the middle or the image in the middle, there's the option to give your address. It's not required. It asks for the city, the state, optional for zip code, and asks for date of birth. And then step 3 for creating an ny.gov ID is it's going to ask you to review your information. So everything that you just put in. The more information you put in, the more quickly your account can be created and verified. And you have to have right now, you have to have an ny.gov ID in order to use NISO or MECM. There is a video here. It's from 2021, so some of the ways that the website looks are a little bit different. And I'm going to put this into the chat as well. But it could be helpful because the steps are still the same. And it talks through how to create an ny.gov ID. Okay, so next you're going to get this slide at a screen like the one you see on the top left right now that says check your inbox. And it will say an email with an activation link has been sent to, and then it's going to be your email. And then it says, please follow the link to activate your account within 48 hours. So then you go into your email. Okay, so that's what this middle image is. So this is what the email is going to look like. It's going to say, welcome to ny.gov ID, and it's going to have your name. And it's going to say, it's going to, have the New York branding, and it's going to say, dear name, thank you for registering. Your username is, please click here to activate your account. And then they give you a unique link. So when you click that, you're going to get this page that's on the bottom right where it says ny.gov ID activation. And it says, thank you for registering. You're now ready to activate your ny.gov ID. From there, you do need to create 3 questions, and there's different options here for the questions and the answers, but you have to do that, and you click continue. And then it's going to say, you have successfully saved your secret questions and answers. Please click the below continue button to set your new password. So you click continue. You get to this activation page where you make a new password, you confirm, and you click continue. That's going to bring you to this image on the left, which is your ny.gov ID portal. And you should see this icon that says New York State of Health. Now, it's an old website, so it's not like super flashy, but you'll look down and you'll look for NY State of Health. If you click on it, it's going to bring you to New York State of Health. For me, I had to, again, sign back in. Okay, so you're on New York State of Health, this image on the bottom right. You go to the top right-hand part of your screen, that yellow button that says sign in. From the drop down, you click individuals 65 plus or disabled or blind. And then it's going to ask you to verify your identity. So it says we need your legal name, date of birth, social security number, and address. The marketplace will only collect personal information to verify your identity with Experian. So it asks for this information. There is an option to, the social security number is not a required line. So you put in this information. The more information you put in, the more likely it can verify you. If you leave information out, it may say, I'm sorry, we cannot verify you. You need to you need to send us documents like, things, for example, like a passport or a birth certificate. So the more information you have that you can put onto this screen, the more likely that it can just verify you on the spot. So you click verify my identity, this yellow button, and then finally you get into your coverage dashboard. Okay. And again, we're going to send out these slides. So if you want a step-by-step, you can use these slides. So in the middle of your coverage dashboard, right now, this image, you are inside of NISO. And MECM is inside of NISO. So you're on the inside. Okay. Now, this is what you're going to see. And you want to click that middle button that says apply for coverage. So you click apply now. And actually, I should make a point that the bottom right-hand part of your screen is going to say chat now. There's the option to chat. They have some pre-written scripts that they could send to you, but they're not going to give you individualized answers. So if you need help, then you really want to talk with an MECM assister who will show you more information about them later. Okay, so a few tips for using the website. First is look at the top of the screen and you want to use that navigation bar. Okay, so this is what it looks like up at the top. It says start, account holder, people, healthcare needs, income, expenses, and finish. So this will show you how far along you are, and you can also click between them. If let's say you're towards the end and you say, uh-oh, I realized that I forgot to add somebody into people, you can click back into people. And you want to look at the icons across the top because they each mean something different. So a gray circle means you have not started that page. A green circle with no check mark means you have started the page. A green circle with a check mark means you have filled in all of the information requested on that page. The name of the page, if it's not bolded, means that you are not on that page. And bolded means you are. So let me just go back for a second here. So for example, these gray icons, I have not started these pages. The green one I have started and it's bold right here. It says start. That means that that's the one I'm on right now. Okay, so another tip is to add a notice recipient. So in the very first section, it's called account holder. The first question it asks is authorized representative completing this application for someone else? Like, oh, sorry, are you an authorized representative completing this application for someone else, or are you completing this application for yourself? If you click self, then it gives you another question down here about notice recipients. And if you hover your cursor over the little I, it gives you a definition of a notice recipient. A notice recipient is not able to act on your behalf, but they will get a paper copy of any letters or notices sent to you. So right now, in these early stages of MECM, we recommend that everyone select a notice recipient from the dropdown and give the contact. There'll be an area later on this page to give their contact information. This is going to make sure that somebody else gets all those notices. So if anything happens and you don't get the notice and there's a notice with a due date listed, somebody else, a trusted grandchild or child or a partner, somebody who you trust will get a copy of those notices. And especially in these early days, we really request everybody do that so that if anything happens and you don't get the notice sent to you, at least somebody else hopefully will have a copy of it. Another tip is to consider adding an authorized rep. So an authorized rep is usually a family member or a guardian who can make decisions about about the client's Medicaid. They can make decisions about coverage. They can provide documents. They can speak with NISO directly about the case, and they can be added on the account holder page. Where it asks, are you an authorized representative? If you select that you're an authorized representative, then and you're the one who's completing it, you should know that adding an authorized representative to the application, the downside is our understanding is that it will prevent the client from getting a same day decision on their Medicaid application. And that's because the state has a process to verify authorized representatives. There's also two forms that can be used to appoint an authorized representative. It's the DOH 5085 and also the so that's to designate someone. And then the DOH 5087 is the identity verification. And I'm going to put into the chat where these forms are so that you can, if my screen will let me. There we go. Okay, so these forms and other important forms for NISO and MECM exist on the website that I just pasted into the chat. And so If you are an authorized representative for someone's account, you want to make sure that you're filling these out. But again, if someone is applying for Medicaid on MECM and adds an authorized representative or says they're an authorized representative, our understanding is the downside is that the client's not going to get a same-day decision on their Medicaid application. Another tip that we have is to keep the option for paper notices. So there's a section that asks about your communication preferences. It says, how do you want to receive notices about your eligibility? You can change your communication preferences at any time in My Contact Information. And the default, the bubble that's automatically clicked when you just get to the screen, is send me letters in the mail. But if anybody wants to, they can change that. And instead of that, they can click send me an email or send me notices in an alternative format. This is, for example, for people who are blind. And for anybody who says that they want an email, this is where they'll put their email address. We recommend, of course, it's up to the individual who's applying, and their family and guardian, et cetera. But because the emails may get sent to your spam, or some of our older clients are not very familiar with emails, or sometimes get locked out of their email because they've forgotten their password. This happens to me too, that sometimes I forget my password. It can happen to anybody. For now, we're saying that if you have a consistent place that you can receive mail, or the client has a consistent place they can receive mail, we recommend that they keep the option for paper notices. But again, luckily there is that notice recipient option up above right here. So even if the letter doesn't get sent to the client for some reason, the mail messes up, someone else is going to get a copy of those notices too. Another tip is to pay attention to, across the top, there's a section called healthcare needs, and it asks you these questions that are listed on the screen. It says, does anyone applying today have Medicare? It says, click on the checkboxes to tell us which programs the client is applying for today, Medicaid and or MSP. And remember, you can apply to Medicaid only, you can apply to MSP only, or you can apply to both. Then it says, would you like to apply for coverage for the retroactive period and or reimbursement for bills you have paid? Does anyone in the household receive SSI? Does anyone in the household receive temporary assistance? That's also sometimes called PA, public assistance, or cash assistance. Is anyone in your household in a medical facility now and expected to be there for at least 30 days? Does the person need Medicaid coverage of community-based long-term care services? Does the person need Medicaid coverage of nursing home care? So those are all the questions. And we recommend that the client or whoever's helping them really pay extra close attention, because the answers on this page differentiate between which cases can exist in MECM and which cannot. There's a little definition. If you hover your mouse over community-based long-term care services, there's a little definition of long-term care services, but we recommend that you just think about this as like, are you getting personal care services at home? Are you getting CDPAP? Are you getting long-term nursing services at home? That sort of thing. Adult daycare, respite care. So if the answer is yes, so just make sure that the client pays attention to these questions. In the income section, again, it's bolded so you can tell that it's on income right now. In the income section, there's 5 different pages to fill out, so there's a lot of information to ask for. Reporting household income, summary of household income, earned income, household income summary, and additional details. Each of these pages has a little button at the bottom that says add comments to your application. And when you click that, then this pop-up box that my cursor is over on the bottom right of my screen, the pop-up box will come up and you can provide more information about your income. If you have anything sort of complicated or nuanced about your income, such as exempt income, and you're reporting it, but you want to make sure that the system sort of understands that it's exempt, or whatever the sort of nuance is, you can use this comment box to type. So, an example of exempt income is dividends and interest earned on savings accounts, including exempt Holocaust restitution accounts, and 1/3 of child support received by disabled or blind child from an absent parent. There's, a variety of types of exempt income. You may want to clarify that on this screen. Um, if you hold your cursor over add comments to your application, there's a little I, and there's a little box that pops up that says you may enter an explanation of your income here if needed. It says do not include any sensitive or health related information, and it says any information you provide may be visible to NISO and DOH staff. Now, all of this information is potentially visible to NISO and DOH staff. Um, if you need to clarify something, even if it is personal information, your entire application is personal information. So use the comment box as you need to clarify anything that you think is nuanced. Okay, another tip, and this is the last one that we have, is to upload documents. Make sure that if you're helping a client or if you yourself are the person applying, if it asks you to upload your documents, you want to make sure to do that. The quicker you do it, the quicker that it can make a decision. And there's many different ways to upload documents. You can do it via mail. You can do it via fax. You can do it on NISO on your computer or phone. So this is just like on the portal itself. Or you can use the NISO mobile upload app. And this is generally what it looks like. It's available on Google Play and on the Apple Store. Um, and I'm posting into the chat a NISO YouTube video, which talks through how to upload documents. The images shown in the video are from before MECM, but the overall process is still the same. So if you get stuck, that's one option. Okay, with that, I am going to turn it over to Rebecca, who's going to talk through NISO appeals.
Thank you so much for that, Rachel. Sort of going behind the scenes to make a little bit more sense about how clients are going to interact with MECM and with these online applications. We're all trying to, and I see a lot of excellent questions in the chat or the Q&A also, and we're doing our best to understand this new system, and we are going to keep, updating the materials with suggestions from all of you to make sure that we are giving the best information that we can for these applications and renewals. So it's pretty exciting to see all of that. And it's exciting to hear that there are these real-time determinations. And also individuals are raising a lot of good questions about how these systems are going to interact with each other. So with all of that, let's take a breath and kind of get to the fair hearing landscape. So in our practices, we often see discontinuances or denials that are incorrect or need to be appealed. And we have a system for doing that. We currently refer to that mostly in the non-Magi world as through a fair hearing. We can continue to do that, but we're also going to share with you some of the language that's part of NISO when it comes to these fair hearing appeals. But before we get there, look, there's already two types of fair hearing issues generally when it comes to Medicaid administrative appeals. They might be eligibility determinations or hearings about eligibility, so budgets, denials, discontinuances, or about services. So am I getting enough home care? Do I have the right durable medical equipment? Things like that. And we really need to be able to distinguish what the issue is for the administrative, for an administrative hearing, because where that issue is going to be heard is going to change depending on all of these factors. And that's what the point of this grid is. So if your case is in, the big change here is for, let me go through all of them before, I'll go through NISO, LDSS, and then MECM. So if your case is in NISO, and you have an issue that your case was closed, your eligibility hearing will be in the appeals unit at NISO. If you have an issue with your services, your fair hearing is going to be with the Office of Temporary Disability Administration, or OTDA. If your case is with HRA or the LDSS, your eligibility hearing and your service hearing is going to be against OTDA or administered by OTDA and against the local agency or the managed care plan. Now, with MECM, we have this new difference. The service hearings are still going to be, if there is a service issue, they're going to be held and administered by OTDA. But the eligibility hearings for the first time are going to be held with, I think there's a little dot that's going to come up, NISO. And so we really want to spend a few minutes sharing what we've learned so far about the NISO administrative appeal system. It's new to us at NILAG in the Evelyn Frank Legal Resources Program because our clients traditionally have not had eligibility hearings overseen by the New York State of Health. So let's jump in onto the next slide. So big picture, there are here's how would you appeal a denial, reduction, or discontinuance in the NISO system? There's a formal appeal through the appeals unit. That's kind of the language that we see in the NISO documents, which we've typically referred to as a fair hearing. And on the other side, we have an informal dispute resolution process, which is like an agency conference when you just previously when you would call the LDSS and try to resolve something if you don't live in New York City or if you live in New York City through the Fair Hearing Division. These two processes, our tip at the bottom should be and can be pursued simultaneously. It's especially important that you pursue both of them if the client has had a discontinuance or reduction in services, because the discontinuance or reduction is likely entitled to something called aid to continue, which keeps services in place, and which I'm going to discuss more on the next slide. This is missing a word not, which we will fix, but the IDR process does not get the client aid to continue. So if the client needs aid to continue, filing an informal dispute will not result in those services. So we really need to distinguish between these two important means by which to resolve an issue on your client's case. So next slide. So let's talk about the formal appeal process or the fair hearing process in NISO first. And the procedure is very similar to if you have dealt with this with OTDA. The overarching procedure is very similar. The operations or what we're doing with forms and where we're making the requests, that's what changes. So let's say our client receives a notice stating that their services are going to stop. We have a very short time frame, usually less than 10 days by the time the notice is received in the mail, to request that formal appeal, that fair hearing with NISO to keep services the same. Now, if you don't need aid to continue, the deadline to request a fair hearing is 60 days from the date of the notice. So that's how that's the time frame by which you're going to request a fair hearing, and we're going to talk about how in the future slides. After the fair hearing has been, or the formal appeal has been requested, you're going to look in the mail for 2 letters from New York State of Health. One is going to confirm your request for a fair hearing. That's an acknowledgement. And the other one is going to be a scheduling notice that's going to tell you the date and time for your fair hearing. All of these hearings take place over the phone. Before the fair hearing, hopefully you're able to submit some documents to support your point of view or your client's point of view. And then when the date and time arrives, you're going to make sure you have a phone that's fully charged, that you have the ringer on so you don't miss the call, and the hearing officer should call you for that hearing. So let's go to the next slide. I just really want to make sure people think about requesting aid to continue, or ATC or AC, again, alphabet soup, before the effective date on the notice. So the effective date of that discontinuance or reduction is probably the most important date that we ever encounter when it comes to our Medicaid practices. And that appeal, that fair hearing, has to be requested before the effective date to get aid to continue. Aid to continue is such a benefit to our clients because it requires that the New York State of Health keep your client's Medicaid or their MSP open and active while you wait for the hearing to be scheduled. The hearing is conducted and a decision is issued. And so it means that our clients don't lose coverage while we fight denial. Next slide. And another key tip, and these are our tips, wherever your client's case is, but please, please encourage your clients to consistently check their mail and to keep their envelopes. The postmark date is going to help us establish if they got enough time before their case was set to close. So it can be a really important tool when we're requesting fair hearings. And we have some law here that's cited about making sure people get notices on time, especially when their services are going to be cut or reduced. Next slide. Okay, so how do you request an appeal or a fair hearing in the NISO system? So really encourage everyone to go to this URL that we have here, newyorkstateofhealth.ny.gov/forms. And, it's very easy to navigate. There are two important documents that we're going to talk about, the DOH 5231 appeal request and the DOH 5232, appoint a representative for my appeal. So for all of us who have been practicing in front of OTDA or we're familiar with the OTDA fair hearing system, you'll note, first of all, that the word fair hearing is not used. So that's why I'm saying formal appeal or appeal request. Here, appeal request means fair hearing. Another takeaway is appoint a representative for my appeal. When you navigate the OTDA administrative hearing process, there's only one form to request a fair hearing and to list somebody as a representative. Here, for a representative to be added to a formal appeal, a second document will need to be completed. For now, our practice tip is that if you're an advocate and you're going to be representing in a fair hearing that's called an appeal, these forms should be filled out and they should be faxed to the New York State of Health 1-855-900-5557. Because this, so far, we believe and our advice may change over time because this is a new system, is going to be the fastest way for you to preserve the fair hearing request and make sure that you are listed as rep so that you're able to speak with the New York State of Health about the issue. Now, also, again, and you hear this in all of our trainings, keep the fax confirmation receipt as proof. So you're really going to want to have proof that the fax was sent and received. And hopefully advocates on the line are able to do that with their office systems. Okay, so let's go to the next slide. So here's the appeal request form, DOH 5231. And it's a little small, but maybe you're able to pull it up on your screen. What I'll say in the middle lane, the second page of the three, is that you're going to check there's a number of issues that the NISO appeals unit oversees. So they have listed Medicaid, Essential Plan, or Child Health Plus. We are asking that the Medicare Savings Program be added to that form. And that's the box that you're going to be checking for anyone who's with MECM. The other three have to do with qualified health insurance plans and people who are purchasing private health insurance on the exchange. You'll also see when you take a closer look at this under section 4 it's the third page of the document, second page of the form, that it says, ask to continue your eligibility or coverage during your appeal. This is aid to continue. It doesn't use the word, but that is what it is. And that box needs to be affirmatively clicked and checked if the client is seeking aid to continue and seeking to keep their coverage open and active while the appeal is pending. So there's a couple of points there, but the main thing is this is the form that does the appeal request. It doesn't say fair hearing, but that is what it's for. It is the fair hearing process for those on NISO. And now let's look at the next form, which is the appoint a representative form. This, I think, can be faxed along with the appeal form. And it asks information about the applicant and who is being appointed as the representative. So if you, again, the main takeaway here for all of us who have frequently appeared in front of hearings administered by OTDA is that there are two forms. And then if you want to be listed as a representative, as a social worker, paralegal, attorney, a second form must be filed so that you can be listed as the representative on that appeal, which is the same as a fair hearing. Next slide. Okay, so we talked about sort of general information about that appeal, which is also a fair hearing. And now let's talk about the informal dispute resolution, or something that you might know as an agency conference. So I will say that in our sort of learn, as much as Rachel and I have been trying to learn about the NISO appeals process, we've heard really wonderful things about the informal dispute resolution procedures at NISO, and that they have been really effective in fixing people's cases, making sure they have the right kind of coverage without requiring a fair hearing. And we're very hopeful that the IDR process will be as effective for these new populations that are coming on to NISO as part of MECM. So our suggestion is that in addition to requesting that fair hearing with aid to continue, which is also called an appeal, that after that's been requested and you've been listed as the representative on the appeal, that we try to resolve these issues through the IDR process. It's, as we understand it, and we haven't had a chance to do this very often yet, or at all, is what the way that you would do this is you would call the NISO call center and say, I want to file a conference or file a claim or dispute about my eligibility. And then that should help the NISO call center worker ask you the right questions or transfer you to the right unit, where you're going to get an opportunity. If you're representing your client, of course, a client can do this on their own behalf without an advocate, where you're going to say something, you're going to explain what the issue was. You know, this income was incorrectly counted. This budget is incorrect. I was denied MSP for the wrong reason, or any of the other variety of issues that we've seen with non-MAGI Medicaid eligibility. And you'll explain what you can about it, providing details, names, dates, phone numbers, etc. You should get a ticket number or a complaint number, which you should write down and track in your systems. And hopefully the issue will be resolved. If it does get resolved, if NISO is able to fix that issue, you're all set. You're not going to need that appeal or that fair hearing. If the conference or the IDR process can't fix your issue, then you're going to need to proceed to the fair hearing, also called the formal appeal. So our, again, sort of to summarize, is file that appeal, file it on time so that your client's entitled to, so your client who's entitled to aid to continue receives it, and then try to resolve it without the fair hearing. And this is similar to our practice right now in New York City when we have an issue with HRA, and we just need to get used to working with it within a new system to hopefully, have the same track record of resolving these kinds of issues for our clients. So let's go to the next slide. I think that, yep, that ends sort of our initial foray into the NISO appeal system. And now let's talk about where to go for help. And I know there have been a lot of questions about this so far. So when it comes to MECM and the New York State of Health, the call center is really a go-to. And it's set up, and we're all going to become more familiar with it, but hopefully, it's set up to help applicants and recipients on MECM to navigate their eligibility. But there are also high cap counselors, and these are folks who are funded through the State Office for the Aging to help Medicare beneficiaries, MSP beneficiaries apply for and keep that kind of coverage. We have the Medicare Rights Center. I'm going around counterclockwise. If you have an issue, you can email us, the Evelyn Frank Legal Resources Program at NILAG. That is our email intake. And those are all kind of forms of free help for low-income New Yorkers. And now I'm going to talk a little bit more about the MECM assisters and the FEABDs. So what is an FEABD? Again, the alphabet soup here. That stands for a facilitated enroller for the age blind disabled category. So to decipher that, we're going to need those are people who can help with applications and renewals for non-Magi Medicaid applicants and renewal and recipients. Many of these, and so let's go to the next page, are going to become MECM assisters. And MECM assisters are going to have access to the back end of the system that Rachel went through with so much detail, and they'll be able to help individuals apply for and renew their coverage on MECM. Would that happen over the phone? Could it happen over video? Could it happen in person? Yes. And so we're really, so far, what we know about MECM assisters, we're sharing with you. The FEABDs have been brought online to act as MECM assisters. And if you go to the last bullet on the slide, as of today, there are 90 MECM assisters that are available to assist individuals who are navigating this system. And then we know from the state that there are plans to bring in certified application counselors and navigators who work with NISO in to become and to be certified as MEM assisters, and that the state is also looking at certain other groups to hopefully bring them on to also be MECM assisters. For now, and the state has said that brokers and plans, there are no plans to bring managed care plans or brokers into the MECM system as assisters. To become an assister, you're going to have to fit into one of these boxes and be identified as eligible by the Department of Health and then complete a training. And once that training is completed, like I've said, they're able to assist with applications, renewals, or to take other actions, answer those questions. And really, we're seeing that this list of assisters grows every day. And I can show you on the next slide what this looks like. And I think Rachel probably put it into the chat. So if you follow the links that's to the assisters, click on the right things on the New York State of Health, you get this list of these 90 individuals who are from all over the state who you can contact directly for help with an MECM application or renewal. It gives you their phone number, their email, the languages they speak, and the counties they serve, and the organization that they're affiliated with. So there's been a big push from the Department of Health to make sure as many people as possible who are already certified as FEABDs are being trained in this new system and are available to help New Yorkers navigate it. I think that is our last slide, and Rachel's going to come back online. We have just a couple of minutes to go through some of these questions. I know we've been doing our best to answer them in the chat as we've gone through, but I'll pass it over to you, Rachel.
Yeah, I was thinking I'll just go ahead and read out in case folks are not as familiar with the Q&A function, because there have been some great questions asked and I want to make sure people have seen the answers. So one of the question that's been asked a few times was answered in a great way from one of our colleagues, Lynn Decker. So I want to give her a shout out. So the question that I've seen a few times is about creating this ny.gov ID. And the question that I've seen is some iteration of, if I'm helping a client, should I create or use my own ny.gov ID or create a new one or use the client's? And Lynn said, if people have a state administered professional license, or have used the state DMV or Board of Elections or unemployment claim, then they will already have an ny.gov ID. If you are authorized for someone else, you will need to create another ny.gov ID for them because there can only be one ny.gov ID per address. Um, so that was helpful. So in other words, you will need to create a new one for the person whose Medicaid account, who is applying for Medicaid. Don't use your own. So that's a question that I've seen a lot of. I've seen some questions about the transfer process between someone who applies in MECM and their case. They apply for non-Magi Medicaid on MECM. Turns out that they are not in that wave one population. Again, wave one, the only cases that can be in MECM right now is non-Magi Medicaid who don't need chronic care budgeting, don't have long-term care needs, don't have a spend down, don't have a pooled income trust. So let's say someone applies and they actually have one of those things, like they need long-term care. The system is supposed to send their information and have some sort of referral process to the LDSS. We don't know more information about that referral process. We hope to learn more when the ADM is published. ADM stands for Administrative Directive. I'm going to put that link in the chat of ADMs. At some point, the state will be publishing an administrative directive with more detailed policy guidance about MECM. And that referral process is something that we have a lot of questions about too. And we're really excited to learn more once that ADM is published. Another question that I saw is about that same scenario. Someone applies for non-Magi Medicaid on MECM, and the MECM refers their case to the LDSS. A few people have asked about which date of application will be used. Again, the ADM has not yet been published, but we would advocate that the initial date of application is the date of application. So even if it is, even if it's referred to the LDSS and the LDSS, there's some reason that it takes a week for it to get over there. Again, we don't know what the referral process is like. That initial date of application is the date of application. So that's what we would advocate for as that date of application. Um, uh, we've had a few questions with like really specific topics like supplemental needs trusts or other things like that. I'll just remind everybody to please go on to New York Health Access. We have all sorts of great articles there that you can find. And I'm going to just paste the New York Health Access website into the chat. Sometimes you'll get a little pop-up that says this website is not secure. I'm not sure why that happens, but I can promise you it is a secure website. All the data there, the download links, all of that is secure. It's mostly done by the New York Legal Assistance Group with assistance from some of our colleagues at Empire Justice and Legal Aid Society. So please go to that website and search it. And we have a lot of great information about supplemental needs trusts, eligibility, and other things like that. Let's see. Rebecca, any other? I guess there's been a few additional questions about sort of what is visible in what systems, like how much about MECM might be visible inside Access HRA, or how much will MECM show you certain dates about your account. Some of that information, unfortunately, we just don't know. So we don't want to give out the wrong information and we don't want to speculate. As soon as there is an ADM that has more detail, and as soon as we get clients that are also interacting with the system so we can learn through them and how we advocate for them, we will share more. And on that point, I want to make sure that everybody knows about our article that we have about MECM. This is our New York Health Access article that's specific to MECM that I just put into the chat. It will be updated as more actually, I guess the full article, that was just the news article, but the full article is now in the chat. It's entry 257. We will update that as we get more information. And so we really encourage you to save, bookmark that page, put it on, somehow save it so you can come back to it, because we're going to make sure to update it over time. And with that, I think that actually we'll go ahead and wrap up because we're coming right to the end. Thank you all so much for coming. And I will just give a plug one more time for our newsletter, which you can subscribe to get information like if we post a new article on New York Health Access about MECM or we have new trainings. That newsletter is where you're going to find it out, how you're going to find it out. So thank you so much for coming. Please feel free to share the slides and the recording, which we will send out to you. And we hope that everybody has happy holidays. Thanks so much. Bye
Thank
bye.
you, everybody.